Good afternoon, ladies and gentlemen. My name is Nirav Shah. I'm the director of the State of Maine Center for Disease Control and Prevention. And I'm here today with Governor Janet Mills, Commissioner Jean Lambrou of the Department of Health and Human Services, and Commissioner Heather Johnson of DECD to provide everyone a statewide update on the COVID-19 situation in Maine for today, Wednesday, May 27th, 2020. We unfortunately begin today's briefing on a sad note. An additional 2 Maine individuals have passed away with COVID-19. One was a woman in her 70s from Cumberland County. The other was a man in his 80s, also from Cumberland County. The passing of these 2 individuals marks the 80th and sadly the 81st deaths of individuals in Maine with COVID-19 who have passed away. As always, all of us at the state of Maine, offer our deepest condolences to the families of these individuals during this time of their grieving. Overall in Maine, there are 2,137 cases of COVID-19, an increase of 28 cases since yesterday. Of those cases, 1,914 are confirmed, 223 are probable cases. Overall, 260 individuals have been hospitalized, and right now, there are 59 individuals currently in the hospital. 25 of those 59 are in intensive care units. As I mentioned a moment ago, sadly, 81 individuals have passed away, and fully 1,357 have recovered. Of our cases, 498 are among healthcare workers. There's one new outbreak I'd like to note today, which is that the Lewiston Ubuntu Care Facility is now reporting that there are 4 staff who have tested positive for COVID-19. Maine CDC has opened up an outbreak investigation, and we'll have additional details in the coming days. I'd also like to provide a brief update on 2 other outbreaks of note. One is at the Cape Memory Care Center, where there are now a total of 68 total cases, 47 among residents, 21 among staff. Maine CDC continues to work with our colleagues at Cape Memory Care to make sure that they've got everything they need, ranging from additional fit testing, PPE, infection control guidance, as well as the support of our spiritual care team to make sure that both the residents and the frontline healthcare workers have everything they need during this challenging time. I'd like briefly to provide an update on our overall laboratory testing work, especially our most recent positivity rates. I'm going to read through a bunch of numbers, and I know that can be tedious to listen to, so please know that all of the numbers that I'm going to be going over are fully on our website. But overall, at a high level, just in the cumulatively since Maine CDC began tracking testing for COVID-19, there have now been a total of 49,599 total tests for COVID-19 conducted across the state. Of those tests, 45,961 are PCR-based tests, and 3,638 are the antibody tests. In terms of our overall positivity rates, cumulatively, our cumulative positivity rate for all tests is at 5.2%. This is a decrease of about 2.2% from last week, where our positivity rate was at 5.4%. Breaking down that rate by the type of test, for the PCR test, our overall positivity rate is now 5.25%, and our antibody positivity rate is about 4.6%. We urge caution in interpreting the antibody rate because of the number, the small number that exists there. But overall, again, as a reminder, our overall positivity rate last week was at 5.4%, and cumulatively this week stands at 5.2%. So we're heading in the right direction, even though we know we have more work to do. For comparison, the national positivity rate averages for across the United States at 11%. Even within the Northeast, our numbers look significantly better in terms of our positivity rate. Massachusetts's positivity rate is at 17%. That in Rhode Island is at 10%. Even our neighbor, New Hampshire's positivity rate is at 7%. Now, we still have more to go, but even just in the past week, because of the expanded capacity for testing at Maine CDC's laboratory, just in the past week, our positivity rate for tests done in the state of Maine in the last 7 days is at about 4.1%. We still have a ways to go. Our goal is to get our positivity rate as low as possible, ideally toward 2%, suggesting that we still have more testing that needs to be done across the state. On the flip side, we are headed in the right direction, even though we recognize that more testing can and should be done. In recent days, Maine CDC has taken steps in that direction. We've not only expanded our capacity at the state lab to more than triple our daily capacity, we've also removed the prioritization system that had been in place not just in Maine, but across the country in other states. Indeed, we were one of, or if not one of, among the first states to remove that prioritization scheme. And just in the past few days, we moved toward recommending universal testing at facilities where congregate care is being, at congregate living facilities after just a single case is detected. So we're taking steps in the right direction, even though we fully recognize that more testing can and needs to be done across the state. We're working on plans as we speak to implement that. So with that, Governor Mills, I'd like to turn things over to you. Thank you very much.
Thank you, Dr. Shah. Thank you for the update, as always. Throughout the COVID-19 pandemic, and our gradual reopening process, the Maine CDC has monitored epidemiological data, such as case trends and new hospitalization rates, as well as healthcare readiness and capacity to inform our decisions on lifting any restrictions. We review those metrics in their totality and in context, as opposed to the daily change of a single metric itself, of course. This includes taking into account the insight of Maine CDC epidemiologists. For example, whether an increase in cases is related to an outbreak in a congregate living facility or to spread among close contacts of a previous positive case. So what do these trends look like? Maine has seen an increase in hospitalizations related to COVID-19, as well as an increase in case counts, particularly in York, Cumberland, and Androscoggin counties. In light of those trends, today, my administration is postponing the reopening of restaurants for dine-in service for those 3 counties in particular. Restaurants in those counties were tentatively scheduled to reopen to dine-in services on June 1, stage 2 of our reopening plan. Instead, they may now offer outside dining service beginning June 1, but not dine-in eating. We believe this change is safer for the health of Maine people and that it balances the economic needs of these businesses with the priority health care of Maine people. I know this is not welcome news for those restaurants who've been preparing to fully reopen next week. It is our hope that by reopening for outdoor dining and curbside pickup and takeout, that we can still protect the public health and perhaps lessen the economic hardship that these businesses are enduring. I've also asked the Department of Health and Human Services and the Department of Administrative and Financial Services, both of which have licensing authority for restaurants. I've asked them to streamline and expedite licensing to facilitate the transition to outside dining, and they have done this. Streamlined permit options are available on the licensing sites. Additionally, the Department of Economic and Community Development today will be updating its restaurant guidance for outdoor seating. We will continue to evaluate the data trends and share a new reopening date for dine-in services in the coming weeks. In the meantime, I encourage the municipalities in Androscoggin, Cumberland, and York counties to consider closing some of their streets, as the city of Portland and some other cities have done, and free up space for restaurants to serve outside in a safer manner. Other than this change, we do expect stage 2 to move ahead as planned. This means that retail businesses in York, Cumberland, Androscoggin, and Penobscot counties may reopen if they wish, with added health and safety precautions, such as restricting the number of customers in a store at one time, enhancing cleaning practices, using touch-free transactions, and strongly encouraging customers to wear masks. It also means that restaurants in Penobscot County may reopen for both dine-in and outdoor dining with added health and safety precautions, including physical distancing the customers, ensuring that employees follow enhanced hygiene and sanitation practices, controlling customer flow through making reservations whenever possible. We believe it's appropriate to allow Penobscot County to join the 12 rural counties in reopening these establishments, given that the county has not had more than 3 cases a day since April. So as of June 1, statewide, with new health and safety precautions, Maine people can go inside a retail store, keeping a distance from others. You can go to a drive-in movie theater. You can golf, hunt, fish, boat, camp, get a haircut, take a dog to the groomer, or take an outdoor fitness class, among many other things. And as of June 1, if you live in Aroostook, Piscataquis, Washington, Hancock, Somerset, Franklin, Oxford, Kennebec, Waldo, Knox, Lincoln, Penobscot, and Saginaw counties. That's a mouthful. You can also eat at a restaurant indoors or outdoors with safe distancing practices. That's 13 counties. If you live in Androscoggin, York, or Cumberland County, you can enjoy outside dining at the restaurants who choose to open. As I've said from the beginning, every day we monitor epidemiological data and emerging science and the experience of other states, and when necessary, we will adjust the reopening plan as we did today to protect the health of Maine people. State government will work to protect you as well. That's why we have more than tripled the state's testing capacity through our agreement with IDEX, and we're working every day to secure more capacity. It's why we have eliminated the testing prioritization system so that anyone suspected of having COVID-19 can be tested if their doctor thinks it's appropriate. It's why we're recommending universal testing in congregate living situations after a single confirmed case. It's why we're expanding the state's contact tracing system, as Commissioner Lambrou described yesterday. And we've announced the deployment of federal funds to expand the state's lab capacity, to bolster rural hospital lab capacity, and to establish drive-through testing sites. Tomorrow marks almost 3 months since the first reported case of COVID-19 here in Maine. 3 months ago, seemingly overnight, a pandemic changed our state in a way we could never have imagined. Since then, Maine people have changed too. Distillers are making hand sanitizer, and sneaker companies are manufacturing cloth face coverings. Restaurants are serving to-go cocktails and delivering free meals to those who need them. Schools are sending tablets home, and teachers are connecting with students over Zoom. The Department of Education is using federal funds and private donations to secure internet access and provide internet devices to help with home learning for 100% of the Maine children who said they needed it. At the same time, we hug less and we wear masks more. You, the Maine people, have adapted your way of living, working, and having fun to keep yourself and others safe. We need to keep doing this because, make no mistake, The virus is still among us, and there are risks associated with almost everything we do. But whatever challenge comes our way in the next 3 months, we have shown that we can rise to meet it. So I ask you again, please remember to wash your hands frequently, 20 seconds at a time. Maintain 6 feet distance between you and others. Stay home when you can, especially if you are older or if you have a health condition or a member of your family does. And wear a cloth face mask, a covering when you're out in public to protect others. Stay local, shop local, support your local businesses whenever possible. We're all in this together, and we continue to be in this together. As Dr. Anthony Fauci said earlier this week, quote, "Now is the time, if ever there was one, for us to care selflessly about one another." I couldn't agree more. Thank you.
Thank you very much, Governor Mills. Governor Mills, Commissioner Johnson, Commissioner Wamber, and I will now turn things over to our colleagues in the media. And today's first question goes to Joe Cortese from ABC 7.
Thank you, Dr. Shah and Governor Mills, for taking my question. The first one I had, one for Dr. Shah, one for Governor Mills. The first one goes to Governor Mills. Your states 2 and 3 still has out-of-staters being quarantined for 14 days. And understandably, that's by the CDC guidelines. When you look up how long the symptoms are affected, it says typically you can see between 5 to 6 days you can see exposure. Has there been any long-term discussion on maybe when that quarantine will be lifted or changed maybe for a timeline before the fall? And for the question for Dr. Shah is, we're coming up to arguably the biggest stage in terms of talking about large gatherings, opening up retail stores and restaurants. What is the contingency plan if things do go south that the CDC is discussing amongst each other going forward?
Well, I might be able to take some of each question. The contingency plans are use of the emergency orders to, again, restrict certain kinds of activities depending on when and where and how another outbreak may occur. And I can't speculate as to what that would be or when that would be or how that would take place. But we're being flexible. We've said from day one, this is a gradual reopening, unlike the original orders that were just all across America, shutting things down. This is a gradual and in some respects a more difficult process to be thoughtful about every stage and to monitor the data to make sure that people are staying safe. The challenge we have, as you mentioned in your first question, is the influx of as many as 10 to 20 million people into the state of Maine. You know, when we talk about testing now, we're talking about testing people who are here. Now we've got to look at an influx where we have a population of 1.3 million, looking at as many as 10 to 20 million additional people coming here, and predictably, customarily, coming here from what are now high-intensity outbreak areas like New York City, Boston, Connecticut, New Jersey, parts of some of those states, all of those states, which still have high levels of COVID-19, certainly compared to the levels in our state. That's what we're very wary about. Right now, the 14-day quarantine, which is based on the predictability of any symptoms or testing within that time period to show the presence of the virus in an individual, that is the most cogent thing we have, the tool that we have right now to prevent outbreaks being brought into the state of Maine. But we're obviously looking at all kinds of other efforts, including expanding testing, including drive-through testing, including the availability of thermometers and other symptom measurements that businesses can have, and schools and churches and others can have to help monitor symptoms. A balancing of all those things that may lead us to change that metric, that 14-day quarantine. But we're looking at what other states are doing as well and trying to work with them to make sure that we're not an outlier. So
Great. Thank you, Governor. I should have mentioned we've got 14 of our colleagues from the media on the roster today. So I'm going to, we're just going to move to the next journalist, who is Joe Lawler from the Press Herald. Go ahead, Joe.
I have, thank you, by the way. I have 2 questions for Governor Mills. One is just kind of piggybacking on the idea of the tourist season coming up and the 14-day quarantine. For a time, Rhode Island had checkpoints of people with out-of-state plates coming in with the National Guard, help them with that. Is there any consideration of that as being one of the tools that you might employ? And then the other question I had is, as you may have seen, breweries are also suggesting that maybe they could have outdoor dining as well, and that they should be in the same boat as restaurants for outdoor dining.
To the extent that breweries are restaurants, they are eligible to have outdoor dining. That's a simple answer to that. And I think about a third of the licensed breweries do have restaurant licenses. And we've been talking to the breweries for weeks and weeks, trying to work with them, different parts of the state, to see how they can how they can reopen to some extent. But we're not there yet for all the breweries. Secondly, with respect to the Rhode Island, the practice of a couple months ago, I think, of stopping all cars with out-of-state plates, we have not considered doing that.
Okay. Thanks, Joe. Next up is Amy Brown from WERU.
Thank you, Dr. Shah. If the antibody tests are known to be unreliable, why are they being included in the positivity rates? And are they in all states?
I can't speak to other states, but when we break out our positivity rates, as you'll see on our website, we break them out for total, we break them out for PCR, and we do break them out for antibody, mainly for the sake of consistency. What is a finding just in the past week, however, is that the percentage of tests that have been done just in the past week that comprise antibody tests has gone down. A week ago, it was about 15% of all tests that were done. In the past week, it's only been about 6% of all tests. So we have seen 8% of all tests. So we have seen a reduction in the amount of antibody testing that's going down relative to other tests that are being offered. But this is a good opportunity to note that as we've been talking about in these meetings for quite some time, unless you happen to be enrolled in a clinical trial or in a research study, I recommend that everybody ask really tough questions before you go in to get an antibody test, because as of right now, the interpretation of those tests is not yet really fully described. And that's why we break out the rate for the total as well as specifically for the PCR on our website, because the PCR test is a much better indicator of current infection as opposed to an infection that may have occurred several weeks ago.
Thank you. And Governor Mills, other than the situation in Sunday River, how many actions or approximately have you had to take against businesses or entities in the state for noncompliance? And do you anticipate and have any special guidance for the upcoming July 4th holiday?
Oh, it's a good question. I'm sure there will be guidance about July 4th. In terms of numbers, enforcement is done at many different levels, in many different forms. Enforcement may often consist of simply the local code enforcement officer checking on occupancy limits, the local public health officer for the town checking on health and safety issues. It may consist of the local law enforcement or sheriff's deputy going to a place of business where there's been a complaint and reminding them of the checklist, and achieving compliance in that respect. I think that's been the most of what you might call enforcement. I don't know how many licensing issues there've been where somebody's gone to court. I don't know of any others other than Sunday River, frankly.
Thanks, Amy. We're going to turn now to Steve Missler from Maine Public.
Thanks for taking the call. Governor Mills, I have 2 quick questions. They're not related. So one of them is about the decision you made here about June 1st and restricting indoor dining at the 3 counties you previously mentioned. Also on June 1st, though, is an expansion of large gatherings from 10 to 50 people. Is there any thought to rolling that back as well in those 3 counties if if the impetus for doing so for restaurants was an increase in hospitalizations and case counts.
Yes, we've discussed that. That's the short answer. No, we've not decided to postpone that increase in numbers. 50 people, depending on where you are, is not very many people. This does not help the wedding industry, for instance. It does not help a lot of businesses who depend on banquets and large gatherings of people. So 50 people, we think, and there are issues about socially distancing within those gatherings. There are issues regarding and mandates regarding wearing masks when there's a gathering of up to 50 people. There's inevitable congregation there, and so we're warning people and telling people they also will have to wear masks at those kinds of gatherings. But it also includes churches, and we've redone our guidance for churches so that as of this weekend, they may allow up to 50 people inside a house of worship to congregate with 6-foot distancing and masks and the like. So it includes a great number of entities, and we believe we can monitor the situation and that people will be safe.
And thank you for that. And I guess my second question is related to some news out of the Department of Labor today about reports of imposter fraud. Do you have a sense of whether or not the people that were trying to commit this fraud were trying to exploit the agency's ability, efforts to dig out of a backlog? Does that make this? Did that issue make this problem more acute than it otherwise would have? Do you have anything to add to that, perhaps?
Thanks for the questions. I think not, because this is a nationwide phenomenon. This is an organized crime effort for the most part. And that is why the United States Attorney's Office and the Department of Justice and Secret Service agencies are all working on this nationally. We predict about 1,000 reports. We estimate we've gotten about 1,000 reports of unemployment imposter fraud. They appear to be similar in nature and a scheme, a widespread scheme that is identical to those schemes in other states. So no, I don't think they're sort of picking on the state of Maine essentially, but I think they're taking advantage of a situation that exists in every state where there is more federal money and more unemployment trust funds going out the door, and every state is under pressure to get those funds out the door. But we're going to do what we can to get to the bottom of it. It's extraordinarily unfair.
Thank you, Steve. We're going to turn now to Caitlin Andrews at the BDN.
Thank you, Dr. Shah. I have kind of two questions, kind of following up on the conversation yesterday about the state possibly releasing more granular data on the coronavirus. You had mentioned potentially you'd be looking to release sub-county data, and I was wondering if you could give me a more explanation what you guys are thinking about what that might be looking like. And then I wanted to ask, so in late April, you had kind of said that there was no threshold the department kind of had for releasing more granular data that, you really wanted to make sure you're protecting people's privacy. What has changed between now and then that has made you more open to releasing more granular data?
So, Caitlin, I'll take those questions in reverse order. What's changed is that we have more cases. So it's never been that we have been opposed to releasing more data. It's always been in the context of making sure we preserve people's privacy. Even though we happen to be in the midst of a pandemic, individuals who are sick or recovering don't cede their right to privacy during these situations. So what's changed is that we now have a significantly higher number of cases, which on a per capita basis means that we can release information at more than just the county level and still make attempts to preserve privacy. We are looking at different scenarios under which we might be able to release data going down as far as the zip code level. We're not sure where we're going to land on yet. As I've talked about for over a month, as you note, we've been looking at ways that we can balance releasing more data without, one, compromising privacy, but two, also doing so in a manner that doesn't result in a map with a bunch of grayed out zones on it because there aren't enough cases that we could sufficiently release those data. Just to give you that in a little bit greater perspective, if we compare just Maine to our neighbor, Maine has over 400 zip codes. New Hampshire has only about 240, which means that on a per zip code basis, the density in Maine is much lower, which means that if we go at certain levels, we might end up inadvertently releasing information on a level where people's identities, because they might have suffered from COVID, could be released. So the thing that's changed most concretely is that we have a significantly higher number of cases, which when we go down to the city, municipality, or even the zip code level, means that we can release more information without putting out a map that would have just had a lot of gray on it.
Let me add, there are, I forget how many zip codes just in Portland, maybe as many as 8. And if you see a map that's per zip code, how many deaths or how many cases, how many positive cases, it doesn't mean that that the virus is more prevalent in the Deering section of Portland versus Munjoy Hill versus Riverside versus the West End. We don't want people to extract the wrong meanings and wrong interpretation from zip codes that don't necessarily have epidemiological significance.
So we're evaluating right now at what level we can release these data, and we hope to have that really sorted out very soon. I'm going to turn next to Dan Newman over at the Maine Beacon.
Hi, thanks for taking my question. Governor Mills, as courts consider reopening in June, could you give an update on the eviction moratorium, and how long do you intend to keep that in place?
Thank you. Right. I don't tell the courts how to operate. We talk to the acting Chief Justice, interim Chief Justice, Andrew Mead, when we need to. He just issued an administrative order earlier this afternoon, about what the courts will be doing June 1, and then June 15th, and then July 1. I can't speak to that. I haven't read it in detail, but the executive order that I issued regarding evictions remains in place. And it does allow for some evictions to go forward, as does the court's order, if there are behavioral issues, if somebody's tearing up the apartment or have committed illegal acts. But for non-payment per se, as a result of COVID, we're discouraging evictions, and the courts are not open for those eviction cases yet. We also are continuing to make payments for under the rental relief program that Maine Housing stood up and helped us with. And we're excited that more than 4,700 people in Maine have received that payment, and many others are still eligible for it, and I hope they will apply.
We're going to turn now to Brian Sullivan at WABI.
Thank you. I just have one question, but if I could get an opinion from Dr. Shah and Governor Mills, that'd be fantastic. I know, Governor, you just mentioned some of the things that are going to fall on the municipalities and enforcement in the state, and like police and sheriffs and things like that. I guess I would just like to hear from both of you about how important you view enforcement as we move into this next phase of opening up the state. I know, Dr. Shah, you mentioned yesterday wanting to have a conversation with people who we deem non-believers. When that doesn't work, where do we go from there?
Yeah, well, I think part of it is consumer choice, too. The Maine public knows what we're doing. Whether you approve or disapprove or agree or disagree with any specific decision or executive order among the more than 40 that I've issued, the Maine public knows that we are doing this in a measured fashion, hopefully a thoughtful fashion, taking into account public health as our top priority. So if a Maine consumer goes to a store, let's say if they go to any facility and the roof is falling in, that's a public health and safety issue, and you wouldn't go there. If you go to a store or facility and the person greeting you visibly has smallpox and you haven't been vaccinated, that's a public health and safety issue, and you're not going to go there. The same with these precautions, because they are based on public health and security and safety. So consumers are not going to go to stores and restaurants in areas that don't have the checklists, maybe a badge at their discretion, or a place which has committed to protecting its consumers, its clients. That's the one big enforcement tool we have, I think, is consumer choice. But secondarily, we have an understanding with law enforcement and with local people about how to make sure that people understand, businesses understand the precautions and how necessary they are. Enforcement comes in a lot of ways and a lot of levels, and we'll be talking more about that in the coming days.
And I would just like to say, I agree. We will turn next to Steve Betts at the Courier-Gazette.
Thank you, Dr. Shah. This is a question for either you or the governor. What advice would you give town officials who are trying to plan their annual town meetings in order to hold those safely?
Well, let me answer, because we've been working on additional executive orders regarding elections and public meetings, trying to gauge things as we go. My town meeting usually has a couple hundred people. So with the gathering rule in effect and going to 50 people come next week, we don't want people to have town meetings in the traditional sense. The legislation that was enacted, the emergency legislation, does allow the towns to carry over their budgets month to month. We're also working on the school budgets and how they can proceed to have some budget and to hold a referendum on July 14th. Many school districts also have public hearings. We really don't want the public to congregate in that manner. Several school districts have been very imaginative about how they can have public meetings and public input in large venues, but we're interested in having the public input through a comment period rather than a hearing where people congregate. And we're interested in having the referenda the same day as the election, the primary election on July 14th. So we're working with the MMA, and they can tell you what we've been working on better than I can, because we've been doing it at several levels with CDC and with our Department of Education and with the lawyers in-house and with the Attorney General's office.
Thanks, Steve. We're going to go to Samantha Hogan at Pine Tree Watch next.
Thanks so much for taking the question. And actually, Governor Mills just jumped the gun a little bit on me. I was going to ask, are you considering an executive order right now declaring the July primary an all absentee ballot election?
No, I've been talking to the Secretary of State's office pretty constantly, talking to municipal officials and the clerks. At this point, we want to preserve the right to vote in person, preserve that opportunity. But we are also talking about guidance that the Secretary of State can give regarding how that's done. And we are hoping to draw down some of the federal funds that the Secretary of State is eligible for to employ plexiglass barriers between the clerks and the voters and the public, among other things, and to maybe buy some PPP for those individuals who are working at the polls during the day and the evening during ballot counting. But we're also working very hard to encourage absentee balloting. My previous executive order allows absentee balloting, no excuse, no reason, absentee balloting right up until 8 p.m. or 7:59 p.m. on the day of election. So that's one major step we've taken to do that. But there may be other ways we can encourage absentee balloting through education and other measures.
We're going to turn now to...
Can I ask one follow-up question? Do you fear, though, at all that if you do not issue an executive order, we could see a very patchwork response to absentee versus some municipalities feeling pressure to open polling locations without adequate staff or without adequate protection for those poll workers?
There really is a question for the Secretary of State, Matt Dunlap, who's been in constant touch with the ballot clerks and with the registrars of voters across the state. And I talk with him. He communicates to me what some of the things that they're talking about. But I think it would be speculative of me to say that it might result right now in a patchwork. So
we're going to go next to Sarah from the Machias Valley News Observer.
Hi, thank you for taking my question. I have two questions. The first one is for you, Dr. Shah. Looking at the $52 million in the federal funding to bolster lab capacity, could you tell me if the state is eyeing any Washington County locations for new drive-through testing sites and what your thinking might be on that? And my second question could be for either. Now that we're coming to the end of the Stay Safer at Home order, and the schools are wrapping up for the year, parents are wondering, when will it be all right for their children to have their friends over? So what's the state's guidance on those type of in-home gatherings?
Oh, good question.
Okay. Well, I'll start with the first one, if I may, Governor. So Sarah asks about the location of expanded testing sites. And Sarah, you're correct to point out that we're keeping a keen and sharp focus on rural parts of the state. We know that testing needs to occur everywhere, especially as we move into the summer and we think about agricultural workers, as well as others that may be there. We want to make sure we offer as many opportunities for testing. So we are taking a look at the entire state, and where there are the highest needs for testing, that's really where we're going. And that most certainly and definitely includes rural parts of the state, like down east.
On the second question, which is not an easy one, because I understand, I get letters from kids every day. I got one last night from a kid who says, "Please open up school. I'm so bored staying home with my parents." She was 6 years old and sent a picture. I understand you're bored staying home with your parents, but you're alive and you're well, and that is the most important thing to us. We encourage people to stay among family members, household members. The stay-at-home order is still in effect, although people can go out for different purposes, broader purposes now than before. We're not at the point of saying you can or cannot have sleepovers. Just remember that everyone is vulnerable to this virus. Everyone is susceptible to it. You don't know whether your neighbor's grandmother or aunt living in the apartment upstairs over the garage has a condition that might make him or her vulnerable, uncle or aunt. We don't know whether there's a child with leukemia down the street who might be extraordinarily susceptible to this virus, or whether somebody has a COPD or other lung respiratory illness in the house next door, the apartment next door to you. So the more congregation there is, the higher the risk. I guess that's the simple synopsis of that.
Sarah, if I could just go back to your former question, even though we're looking to expand the number of testing sites across the state, particularly in rural counties, there already are many opportunities to obtain testing. Hospitals, community health centers, and federally qualified health centers, to say nothing of doctors' offices and other locations, are already offering testing, even in the most rural parts of the state. We're looking to expand that even more.
Dr. Shah, may I have a follow-up question to that?
Sure.
In speaking to one of our healthcare facility CEOs here earlier today, they shared that though those things are all true in practice, they're still not true are all true in theory. They're not yet true in practice for them, because they're still having a really hard time getting swabs and PPE. So they're only able to serve, they want to be a community testing site, but they can't. Mm-hmm. So I understand that's a statewide issue, and certainly you've addressed it all along the way, but what would you say to these facilities and these small places who feel like they don't have the materials to really open the doors to wide testing? So
it's not just a statewide issue, it's unfortunately a national issue, both PPE as well as swabs. However, Maine CDC has been receiving occasional shipments of swabs from FEMA, and as soon as we get those into our warehouse, we push them out. My recommendation to the hospitals that you noted would be to make sure that they keep doing what they have already been doing, which is making requests of the Washington County Emergency Management Agency. Washington County will get those requests to us, and we'll get them filled as quickly as we can.
Thank you.
We're going to turn now to Megan from WMTW.
Thank you for taking my question. This question is actually for Governor Mills. Well, when we first started to see unemployment claims skyrocket here in the state, the claims were expedited, we know, to help those who are having trouble making ends meet when they lost their jobs. Mm-hmm. And so now, while these cases of fraud are being investigated, that 10 to 14-day lead time is reinstated seemingly indefinitely. So what do you say to the Mainers who are still having trouble filing now, cannot get through on the line, and especially now that the processing period is back to normal, that's 14 days, they're still waiting for benefits, and also given now that there's that freeze for 48 hours. So what do you tell the Mainers who are still waiting in the face of more waiting now?
Well, thanks for the question, and I have a great deal of sympathy for those individuals who are still waiting. There may be any number of reasons why they're still waiting. They may have been scheduled for fact-finding because the department has requested information from the employer, the previous employer. There may be a number of reasons, maybe inadequate information. And I wish we could satisfy all of the individuals. I've also gotten letters from people who have praised individuals in the Department of Labor for answering their inquiry and getting their unemployment benefits in a cordial fashion. So, two sides to that coin. I don't have the current data. We'll have current data tomorrow from the Department of Labor about the current statistics. But I do not want millions and millions of dollars of this trust fund to go out the door to the fraudsters who are preying upon people and businesses all across this country. The result of that would be potential increases on insurance on the employers and businesses in this state and in other states, and the result might well be the denial of unemployment claims for all the wrong reasons. That is, somebody's already filed on your behalf. That's what's happening. And that's why some people are being held up, because some fraudster filed with their name and social security number. And I've had those complaints from businesses and entities across the state. And that's what we're trying to get to the bottom of.
Great. Thanks, Megan. The next question goes to Baron von Don Kerrigan.
Yeah, very nice. Good afternoon. I have two questions. One, Dr. Shah, for you, and one for Governor Mills. First for the governor. What about the phase 2 and hotels in all the counties of the state?
What about them?
Are those rules proceeding even in the 3 most populous counties?
The same reopening protocol applies, correct. We have not changed anything with respect to hotels and lodging, except what we did last week in moving up campgrounds for Maine residents for Memorial Day.
So the concerns that prompted you to still not have eat-in dining in those 3 counties are not a concern with hotels?
I'm sorry, what? Yeah, June 1, I think there's some confusion, and understandably, June 1 begins opening lodging for non-emergency workers, for Maine residents only, or people who are quarantined for 14 days in the state of Maine. Right. That's still in effect for June 1. Does that answer your question, Don?
It does. I guess I was asking that you don't have the concern about that's keeping the restaurants closed for in-person dining. You don't have that same concern about the hotel.
Well, right, because in-person dining in those counties where there are high numbers brings people together in the same room, in the same facility, inside. Some of the factors we look at are whether or not the activity is sedentary, whether or not it's inside or outside, and people generally take a hotel room. You know, they don't bring 10 people with them in one hotel room. Mm-hmm. Those are all factors. We have not changed the protocol with respect to hotels yet. Yes.
And a question for Dr. Shah. If we look at numbers, it looks like about 90% of the current active cases are in those 3 counties, Androscoggin, Cumberland, and York. Does that tell you anything about either the virus being on the way out in the rest of Maine, or that you need to take extra steps, including expanded testing perhaps, in those 3 particular counties?
Sure thing, Don. So Don asks about, Don rightly observes that much of the active number of cases that we see are in the 3 highest counties of transmission, Cumberland, Androscoggin, and York counties. Don, your first hypothesis was whether that means that for the other 13 counties where we've seen not a spike in cases, maybe that means we could be on the way out. Unfortunately, the answer in this situation is a scientific one, which is to say we don't know for sure. The virus came so quickly that it could just as easily recur in one of those rural counties. And in other parts of the country, what we've seen in rural parts of other states has been, unfortunately, a recurrence. So we remain on guard and looking at the data on a daily basis for the possibility of resurgences or spikes like that, even in rural counties. What I think we see when we look at the data from the 3 highest counties is a continued number of cases both associated with congregate care settings, long-term care, facilities of that nature, as well as cases that are just being transmitted in the community. Yep, okay. We are going to turn now to Brad Rogers over at WGME.
All right, thanks very much. For either you or the governor, Dr. Shah, I agree that case counts are rising, but you said it yourself, most of them are from long-term care facilities, assisted living centers. Is the number really that high that restaurants and even bars who have safety precautions in place and eating, why couldn't they open up? Are the numbers really that high if you take away the long-term care facility outbreak?
Why would you take away the long-term care facility outbreak? So, I mean, it doesn't grow in the flower pots in the nursing home. It comes from the community, comes from outside. I think there's this apprehension that you're safe if you're not in a nursing home or a congregate care facility, and that's just not true.
Mm-hmm. That's absolutely correct. The virus tends to be introduced by visitors or outsiders to these facilities, be they employees or others, and that's one of the reasons why we are particularly concerned about congregate care settings in high population areas, but we're concerned about them all over the state. Brad, the other two factors that I think are different are just the number of cases per capita in these counties, these 3 counties, is significantly higher than the other 13 counties. In Cumberland County, for example, the number of cases per capita per 10,000 is 36 cases per 10,000. Compare that to Piscataquis, where it's just about 0.6. So a marked difference between Cumberland, York, and Androscoggin compared to the other parts of the state. The other piece, and this kind of dovetails with what Don noted, it's not just so much the location, but the type of activity. Restaurant dining, for example, combines duration as well as density. You have a high density environment with a higher, longer duration of exposure. Those two things are different from, say, jogging outside in the park. And yep. Go ahead, Brad.
Sorry, go ahead. I wasn't sure if you were
cutting into General Hospital.
Governor Mills.
What's that?
I'm Governor Mills. How specifically is the state handling the unemployment fraud right now? And what's the plan to handle this? And is the Attorney General's office involved as well? Or are they investigating it internally at the Labor Department?
No, we're working with the U.S. Secret Service and the U.S. Attorney's Office and the Maine Attorney General's Office, the Maine State Police, the State Treasurer, and the U.S. Department of Labor. I have a call later on today with the Secretary of Labor in a short while. And the Social Security Administration, the federal and state governments are working together on this. This isn't something that we can solve on our own. It is a national, if not international, phenomenon.
And the last question for today goes to Patrick Whittle from the AP.
Yeah, thank you very much. Some of my questions were answered earlier as I'm here at the tail end of the parade, so I thank you for that. But it's been a bit of a while since we talked about mental health. Could you give some kind of a picture of how the state's mental health care providers are handling this stage of the pandemic, and how if there are enough services to meet all the needs that must be out there right now?
I don't have an answer for you on that. I think it's something we're looking at, trying to keep tabs on. We hear from the providers at different levels, different stages. I think the telehealth phenomenon was a little more difficult for them to engage in, for mental health, behavioral health therapy, than it was for other kinds of therapies. But we're concerned. We were concerned during the snowy, rainy times of late spring that depression might set in to a larger extent than otherwise. We are communicating with the providers to make sure they have what they need to provide help when and as it's needed.
Great. Governor, that was the last question.
Oh, it was. Mm-hmm. Thank you. Well, thank you, Dr. Shah, again. I'm on weekly calls actually bi-weekly calls with the other governors. Yesterday I was on a call with the other governors and with the White House with Vice President Pence and Dr. Fauci and Dr. Birx. And we talked about testing, we talked about thermometers and many other phenomena and what other states are doing. And I'm pleased to be part of the National Governors Association, to be a member along with Doug Burgum of North Dakota, who just the other day held a press conference to talk about the meaning of wearing masks and why it's not a partisan divide, why it doesn't mean anything about your philosophy or your needs or your characteristics. He said, this is one time when we truly are all in this together. And likewise, my another compatriot, Mike DeWine, Republican governor of Ohio, said last night, wearing a face mask, a covering, is not about politics. It's about helping other people. Let's keep that in mind. And I'm pleased to wear this mask that was designed and made by a person named Billion Dolby of Hollowell. It's fishing season. Thank you very much.